All right, let's get started. My name is Corinne Walda. I'm the Economic Development Director of the Boulder Chamber, and I'm welcoming you to this week's Limited Healthcare, Personal Services, and Retail support call. We do have these times weekly so that you can get your questions answered, get up-to-date information on your industry and across the board about COVID-19 and Boulder County, and also to provide feedback when requested. Whenever you have a question during the session, please put it in the Q&A feature or in the chat, and we'll ask it on your behalf later in the program. Please join us next week because you'll hear there may be some additional updates that come out this next week about the next phase or where our state is heading. So do not be afraid to sign up every week, and if you're not able to make it, I'll send you out the video so that you can get up-to-date information. At this time, I'm going to hand it off to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. And thanks to the Boulder Chamber for hosting these as well. We'll just jump right in. Up first, we're really going to focus on sort of an overview of the situation, whether it be from the public health order perspective or the epidemiological perspective. Then we'll jump into a little preview of what's coming next from the public health order world. And then we'll jump into sector updates and Q&A after that. So this timeline has not changed very much. The big change this week is that we found out yesterday that as of July 6th, the state expects to begin accepting applications for Protect Our Neighbor, and I'll get into that in a little bit. The reason that we like to talk about that, the timeline as it's gone along, is that this is a long-term issue. It's going to be with us for months, and that's because the coronavirus is just as contagious and just as dangerous as it was in January, and it will be that way until we have a vaccine or an effective treatment. And so that's why you've seen this sort of evolution of orders that has slowly opened the economy up. It really has to do with how we can do that safely. And part of doing that safely is face coverings. And yesterday it was also announced that the face covering order for Boulder County would be extended indefinitely. And I really wanted to hit on, this is a lot of text for one slide, and I apologize, but I think it's really important. These were points that were included in the press release from Boulder County, and I think I really want to hit on them here because I think they're important for businesses and for just all of us as residents. Face coverings and wearing your face covering in the appropriate situations really sets an example. It's way better to set an example than it is to scold strangers for not wearing a mask. Your behaviors really have an impact on other people. So doing things like wearing your mask, moving away if people are crowding your 6-foot bubble is important. And really focusing on ensuring that your friends and family are aware that you're trying to maintain social distancing and wear a face covering. That's the best way for us to reinforce the need to wear face coverings. And I think I'm going to get into a little bit of this risk and benefit of activities in a little bit, but also think about what level of risk you're comfortable with on a day-to-day basis. That's really important for face covering, but also just for general contact with the public. In terms of face coverings, like I said, we updated the face covering guidance. It is now indefinitely, it's in place indefinitely. Just again, we've put this in a number of presentations, but the face covering script is our attempt to try and get at that question of what if you have a customer that doesn't want to wear a face mask, doesn't want to wear a face covering, but still wants to shop. Are there tools and ways that you can do that? And that face covering script gets at those, and it's linked. This link goes to our website. Cami and I had a little concern earlier today when we couldn't get into it, but it's up again and working. So definitely use that as a resource when you can. I mentioned the risks and benefits model, and that was mentioned in our press release, the county's press release about this. But I think it's really important to think about what you're doing and what your group of friends are doing and all of that, and how those different activities expose you to different levels of risk. And this is a really personal responsibility thing. What level of risk are you willing to take? And how does that impact your family, your friends, and your business? And so thinking about how to enjoy Colorado, enjoy the summer, but thinking about that risk equation as you go. And really this, I think this model that comes from the state's website that just shows, as you do these things where you're around other people that you don't spend time with regularly, you're going to increase your risk of getting COVID-19, but also risk spreading COVID-19. So just an important way of thinking about risks and benefits. Just an update about the current public health order. We're in the 7th revised order, and we expect that there might be some updates that would create an 8th revision to that before Protect Our Neighbors, but as there aren't many days left in this week and Protect Our Neighbors is supposed to be released next week, I don't know whether it'll be this week or next week that any revisions to Safer at Home will be made. And I'll explain why those revisions might continue even after Protect Our Neighbors goes into place in a minute. As a sort of side to that, with the 7th revised order, we decided to remove our county created checklists from our website that were by sector in favor of asking you to go to the state's website and look at they essentially now have checklists, and they do try to update them as quickly as possible. And what we really wanted to avoid was confusion. Sometimes they don't update them as fast as they update the orders, but we didn't want to have 3 different versions at any one time or anything like that. So what we're encouraging you to go to the state's website. And if you go to the state's website and you hear us say, the orders have been changed to say X, Y, or Z, and you go to the website and their website does not say that, check the order itself. That's where we're getting our information, because that is where the official guidance is. Everything else is an interpretation of that guidance. Just a little quick update about the outbreak that occurred a couple weeks ago at this point. I think the message here is that we saw a peak that was related to specific behaviors. We are now coming down off that peak, but coming down off that peak really had to do with everyone continuing to wear masks and social distance, and that behavior is what is going to bring us down to safer levels of new cases. And Corinne and I were talking about this earlier. The state just released a bunch of data about statewide information. And one of the things that's come up a lot is that the reproductive rate, the R naught value related to the virus, has been below 1 for quite some time. But with the spike around the country and possible spikes in Colorado, we're seeing it creep up closer to 1, which is the point at which new infections are growing faster than people are getting out of being infected. So that's a dangerous point for us, and that's what we want to avoid. So really returning to that question of what level of risk are you willing to take for your community, for yourself? That's I think the important message that we want to get out there about this, the outbreak that occurred a couple weeks ago. All that said, the governor announced that as of July 6th, they will be accepting applications for communities, in this case the county, to enter into Protect Our Neighbors. It's an application-based phase. And what that means is that there will be counties and cities that stay in safer at home because they can't reach the thresholds necessary to apply and be accepted into this more open phase of protect our neighbors. And so I think it's really important that we as a community look at ways to get to the point where we can safely move into protect our neighbors. To that end, information. And I really feel like the information provided on the state's website and our local website is really meant to help you understand what you can do to protect yourself and your business. These other resources are useful for Energize Colorado is really useful for obtaining materials, cleaning materials, or PPE. If that continues to be a problem in terms of resource pipelines, that's a source for that. And then the rest of these are places you can go for information specific to businesses, whether that be your industry or businesses in Boulder, for example, with the Boulder Chamber. We've also encouraged people to go to their industry association. How are businesses like yours responding to COVID-19? It's a really helpful thing to look at. With that, I'm going to jump into sector-specific information. And I'm going to selfishly start with my own sector. And really, there have not been that many changes. Cammie's going to go over some of the changes that affected both personal service and limited healthcare. But I think these are the three reminders that appear at the top of the state website. So I think they're really important for you all to keep in mind. Offices must only be open at 50% or 50 people per room, whichever is lower, and that's 50% of the occupancy of a specific room. If you have shared spaces, that means the shared spaces need to be at 50%. So working with your neighboring businesses would be important. All of the requirements that were in place before about how to take care of those rooms, how to clean them and make sure they're disinfected between customers are still in place. The guidance from the state continues to be that employees within the limited healthcare field need to wear medical grade masks. Customers can wear cloth masks. Customers can wear other face covering types, but employees must wear medical grade masks. And the big update from a couple weeks ago that affects both personal service and limited healthcare is that procedures under the mask are permitted. You can have your customers remove their masks as long as you as the provider wear a face shield and a medical grade mask in limited healthcare. Gloves are also required unless you cannot wear gloves, and then hand washing is required. But the big change in limited healthcare was this change from no services below the mask to now allowing it as long as you can increase your PPE with the face shield. With that, I'll turn it over to Cammie.
Thanks, Jesse. So since our last webinar, there hasn't been any new additional updates, and that we don't know of any pending updates are coming, but I thought it might be helpful just to review the most recent set of changes, which is very similar to what Jesse just covered for the limited healthcare folks. But just as the number one reminder, because it really is pretty much the reason for most of the calls and complaints and concerns that we're getting in the call log still, is that masks are still required by all staff and clients. So we have on our website in here an additional guidance for how to wear masks correctly. And I think a lot of the calls are that people might have masks that might be hanging down low or below the nose or below the mouth, and they're not really on. And people are still moving through businesses and it's making a lot of other clients or other staff members uncomfortable, and we're getting the complaints. So just know complaints can start to pile up on businesses, and part of that is really management or as peer supporting each other to really wear masks properly. It's quite important, I think, to have the community feel safe to keep coming to your businesses, as well as it's still the requirement that you wear a mask by all staff and clients. And that the big change, like Jesse mentioned, was that non-masked services can now be provided. But I just want to make sure it's clear, clients still must wear masks all the way through entering, exiting, walking through a facility. The only time that they are allowed to take off their mask is to pull it down to directly receive that service, and then pull it back up as soon as the service is done. And they need to be wearing masks the entire time. So as they pay, as they move through the facility, as they use the restroom, whatever it might be, as they're there to receive other services, masks still need to be on by clients as well. So not a whole lot has changed as far as the mask requirement, meaning that everyone still needs to be wearing them at all times, whether they're staff or clients, other than it can be pulled down to briefly allow more of those facial services to be given and then put back up. So just to try to clarify that, because we did see an uptick in complaints and concerns from the public, and it is a mix of public calling and staff calling on their own management saying, we're not doing it correctly and it's making me uncomfortable. So just know that is definitely going on. And that in addition to masks being able to be pulled down temporarily to receive a facial type service, is that the staff now must have face shields. So businesses must provide face shields for anyone in a personal service setting to be able to offer those services where the mask comes off a client. Those face shields must be disinfected between every client. And it's still, like Jesse said, the one big difference between personal services and limited healthcare is that limited healthcare folks have been required and still are to wear a medical grade mask. Those in the personal services field have not been required to wear a medical grade mask, but it is now highly encouraged and strongly recommended that for those that are providing services where a client mask is coming off, that they be given medical grade masks as well. You are still allowed as a staff member to have a cloth mask. In addition to that face shield, you need to have both, but you aren't required to have a medical grade one, though we're really recommending that you do and treat it the same as a limited healthcare kind of situation, or staff who work in limited healthcare settings. So let's see, what else did I miss? Oh, the other suggestion is that where non-mask client services are being provided, try to do it if it's all possible in a separate room or a separate space, so there is no one without their mask in any of those shared spaces. So the idea is if you could relocate those to a safer situation, that is definitely the ideal. And just to kind of clarify what has always really been the difference over the last few weeks, but now it sort of applies to both settings, whether it's limited healthcare or personal services, is that for those who are providing services under the authority of a physician, even if you're a personal service setting, you might still be able to provide services under physician guidance. You need to follow limited healthcare guidance in those type of situations. When you're performing possibly the exact same service, but it is not necessarily physician guided or physician prescribed, you may follow the personal services guidelines. So just, we know a number of settings in this group who are in these webinars might be bouncing back and forth between the two sets and possibly all three sets of guidance we're talking about today. As we know, the retail applies to a lot of you as well, and we'll get to that next. But just as a reminder, the whole space situation, just like Jesse said, in your settings, you're still limited to 50% of your capacity for that space, or 50 people max, whichever is fewer. So just make sure that you aren't necessarily overfilling your spaces between clients and staff, just a reminder, and that masks really should be still worn by everybody all the time, except in those services where they are now allowed to pull those off. Try to have those separated out if at all possible. But the staff have to have now the extra layer of the face shields on top of their mask to be able to provide those non-mask client services. So those are really still the big updates from last week that we went over. And like I mentioned, we don't know if there's pending ones. Thank you, Jesse. And just to remind you, we do have the social distancing space calculator. If you haven't done that yet, and I suggest just go back and verify if you're kind of hitting the number, you know, if you weren't 100% sure if you were kind of hitting those space limit numbers correctly, go back and check the space calculator out to see if you're kind of in the range where you need to be. And that we just want to reiterate that face covering script is really there, and we designed it to help you kind of maneuver through those different situations where clients might come in saying they can't wear a script, or excuse me, can't wear a mask or a face covering, and how do you kind of maneuver through those conversations. So that's really what that script is there for. So we hope you find that helpful. And lastly, I know this has been brought up a couple of times. There are a number of business types in here that are regulated by Dora. And so we bring up Dora Guidance a lot. They've done a great job putting together some resource lists and FAQs that really break down what's in the state order about what you can and cannot do. And we just want to keep suggesting that even if you're not a Dora regulated group, you might still want to go check out this website we've provided for you in the Dora Guidance, because there's a lot of best practices that you could implement that they've written down that you might benefit from, even if you're not a Dora regulated type agency. So if you think you have a similar type of setting or want to just learn what other groups are doing that might have a similar space setup as you, even though your type of business might be completely different, you might get some great ideas from these Dora updates. And again, just thank you to all of you on the calls who've been providing, whether it's directly to Corinne or to us. As soon as you get a Dora update, we sometimes, you know, get it after you. So it's thank you for sharing the resources, as we always want to make sure we're giving out the latest and greatest information. And Dora does a pretty good job of clarifying items as the orders from the states are updated. So I think we're going to kick it over to Ambra next, who's going to cover retail for us.
Hi. My name's Ambra, and I'm going to be taking over the retail sector for Angel. And wanted to start off with just reviewing some curbside service. And this is also, just wanted to make sure that you know that this is different than the outdoor retailing, which if you are doing outdoor retailing, please follow the retail guidelines for that. But just to review some curbside service. So offer goods through delivery service, window service, walk-up service, drive-up service, curbside delivery, or any other manner, allowing for strict compliance with mandatory social distancing requirements. Implement a 6-foot distancing measures, so just making sure that there's marked space in checkout lines, so marking on the floors of where people should stand. And then encourage virtual payments and minimize exchanges of debit card and identification cards. You know, so looking at maybe doing some payments in advance. And then also providing PPE for employees who are managing deliveries, returns, and having employees wear gloves, face coverings during these customer interactions. Create signage to encourage the use of face coverings, masks, and gloves by customers. So just posting those, you know, in those curbside areas where they'll be picking up the products. And then elevate and increase the frequency of cleaning practices, including sanitation of high-touch areas. So, you know, if they do have, you know, a payment thing outside, or you have a table set up where they're picking things up, that you're continuing to sanitize those on a regular basis. And then restrict return policy to only items that can be properly sanitized prior to reselling. And then lastly, just providing a staging area outside for hands-free pickup, and post signage for call-ahead pickups as well. Next slide, please. And I just wanted to review the slide that Angel had up last week, and then also just talk about, you know, a couple of the calls that we had come in this week. I would say we probably had about 3 calls just regarding employees not wearing masks. And so, you know, just looking at talking with your employees, constantly reminding them that, you know, those are a requirement while they are on their shift. And then we did have a couple of critical businesses that were not in compliance. And just, you know, really having, if you are a critical business, just remember to reviewing what the current guidance and requirements are, as that has changed since you've been in operation. So that was mostly what Angel had focused on last week, but just, you know, also wanted to touch on a couple other things. keeping flexible or remote scheduling when possible, and then installing shields or barriers. And that was a big one that had changed between the critical and non-critical retailing. That is a requirement now. And then disinfecting high-touch areas, and then avoid gatherings. So, if people are gathering in break rooms, kitchens, and then just in general, just meetings, just avoiding gatherings. If you can do things online, or just remember that they need to be 10 or less. And then lastly, just continuing to do symptom monitoring protocols and having those in place. So I think that pretty much sums up the information I had for retail this week. Thank you.
Thanks, Ambra. I needed to get off mute there. Just quick review. This is, the 3 p.m. personal services, limited healthcare, retail call. We have other industry office hour sessions all afternoon on Tuesday. And then Wednesday at 6 p.m., the Latino Chamber and Boulder Chamber co-host a Spanish language session. Those are subject specific. So if you're interested in that, definitely reach out to the Latino Chamber and Boulder Chamber for more information about those. And definitely, we are waiting on more details about protect our neighbors. And as soon as we have that, we'll be preparing our presentations for next week. If it comes out this afternoon or tomorrow and you have immediate questions, definitely you can contact us at covidbiz@bouldercounty.org. If you have questions or concerns about businesses, please contact the call center. The number's there. And just as a sort of reminder, as of next Monday, the call center will be reducing its hours to 9 to 2 Monday through Friday. So continue to use that service, but if you have questions directly for us, you can use the covidbiz at bouldercounty.org email. Happy to take questions.
All right, so our first question is from someone new to our state. So I think every state calls these phases very different. And we've, some states, when we did stay at home, it was shelter in place. And, we had stay at home, and we had safer at home, and we've had 7 variations of safer at home, which is, limited, stay at home if you can, limited openings of businesses, and they've been phased. Somebody asked, what is protect our neighbors? What is that? What does that really mean?
We're not quite sure yet. They have not released the full plan yet, but I think the big takeaway that we're aware of based on the information they released when the governor announced it is that instead of having a variety of sector-specific limits on the number of people who can be in a space or the percentage of opening, they're going to have sort of a more across-the-board space limitations. And they're going to be based on what we've been calling the social distancing calculator. It's really a space calculator. It takes into account the space you have available, as well as the number of obstructions you have on the floor and things like that, the stuff that takes up space inside your business, and gives you a number that meets whatever requirements the state puts out as of that when they release that information. And that's what we understand is going to be in there, but we do not have exact figures yet.
So it's the next iteration of our reopening efforts within the state. And to be clear, the community has to qualify. So you're going to have an application as Boulder County community to qualify to move all businesses to that phase. There's no individual business applying. There's none of that. It's the community. And our numbers matter. Our numbers as a community matter. And with July 4th holiday coming up, with recent outbreaks, what are some of the things we need to do as a community to make sure that we can move forward together into that next phase?
Well, I think, we've been trying to hit this message the last couple of weeks. as changes have slowed down, and that is the mask orders are in place for a reason. They really do have an impact on transmission. So wearing a mask, encouraging those you work with and live with to wear masks when they're outside the house, when they can't maintain 6 feet of social distancing, when they're in businesses, that mask wearing really has an impact. And I think it also goes to what we talked about earlier in terms of assessing risk. What level of risk are you willing, not just to put yourself into, but your family and your friends? Understanding that every action you take beyond staying in your house all the time is going to increase the chance of getting or transmitting COVID-19. So I really think the mask wearing is the best thing for an individual to do. Washing your hands. I remember a number of weeks ago on one of these calls, someone mentioned that really what the best way to protect yourself from this virus is to do what your mother and father and authority figures have been telling us to do forever. Wash your hands, don't touch your face, wear a mask. Those are the sorts of things that are going to protect you and your family from getting this virus.
Okay.
I'll just add to that, Jesse. I think the state's current campaign is, especially going into this holiday weekend, is do the big three, which is the wear your mask, wash your hands, and social distance. And just don't push those limits, especially as more people are probably naturally going to gather because of the holiday weekend, is to really consider if that's something you want to add to or not, kind of that social responsibility thing. But they have a campaign going around the big three.
Big three.
I didn't even know about
Thank you. So, to just, finish off this discussion. So the next phase for the loosening would be the protect our neighbors, but there's no guarantee we won't go backwards into stay at home. For example, Governor Polis just announced that bars are going to have to close again because of, higher numbers, and that's been seen as trends in other states. So we need to continue moving forward, protecting ourselves so that we don't move backwards.
I think that just speaks to the fact that in all of our sectors, regardless of what they are, those of us who are answering the calls and complaints and concerns, as across the board, we're hearing more and more often that it's the mask issue that the public is not comfortable with. It's a mask issue that staff aren't comfortable with. It's a mask issue of not seeing management and owners following the rules. And really, that's the only thing that's going to get us to this next phase. So just even from a business perspective, if you want to be able to move your businesses to the next phase, we're going to have to be compliant with the current mask orders and social distancing orders and just kind of deal with it for a little bit longer. But we could very likely go backwards if we have another spike again, which has happened the last time there were mass gatherings. So we're nervous about what's going to happen over the holiday weekend and really hoping we don't have another spike that just makes it take longer for us to get to that protect your neighbor phase. We won't even be able to apply if we have another spike again. So it really is on individuals to really hold this kind of space a little bit longer, as annoying as it might be, because it's really what it's going to take.
So speaking of masks, let's say a client comes in and you're, oh, we're friends, we don't need to wear a mask. Is that really the proper way to really act? That I know you, you know me, let's not wear a mask. Is that okay?
It's understandable, and it's hard because we naturally miss it and want that socialization. I think it's part of it. We can still have the socialization, but we still really want to keep that space and that transfer of droplets, even from people we trust the most. It's still a risky situation when the masks are down and the touching occurs. So as much as we want to have that physical distance without the masks, it's still not a great idea. It's just as contagious as it's always been.
Okay. So we have a question. How do you protect the next client coming into your treatment room when you only have one treatment room and only see one client at a time? If you're doing, you're doing procedures on the face requiring the client to remove the mask, but you're wearing a medical grade mask and face shields. So it's a long question, but I think it's what's the best method to protect the next client if you've allowed the previous client to take off a mask for a service?
question, and I think I got the gist of it. And so one of the best practices that's out there is to really ensure the timing between clients is managed well by the service provider, which means you don't have a client come in until, especially if you're talking about this one room situation, until the other client has exited. So a lot of people have instituted like text or call situations where they don't come in until you sort of invited them in, because as a service provider, you also need time to clean and sanitize in between clients. So there shouldn't be clients passing one another where one is exiting and one is coming in, because you need to stop and take time to clean yourself, clean your area. And that a lot of places are only calling people into their spaces once they know their space is ready. So the clients should have, the client exiting is long and gone before the next client is coming in. So it's not going to be that you can probably service as many clients as you once did before, where they could come and go and kind of have a waiting room. Now there's going to be a bit of a gap between clients is the best way to manage that.
And probably the cleaning between the two, making sure if you're wearing that face shield's properly sanitized, you've replaced your mask
seat
and
that
your
they
gloves.
were in, the chair that they were in, if door handles, whatever it might be, if the restroom was used, you might just need to take a break, and that you really should space your appointments to allow for cleaning and safe exchange where the other client has left before the other client comes in, and that you stagger those appointments. You don't stack them, which might have been normal practice before, but they need to really be staggered now. And especially since the rule is still no walk-ins, appointments only, that you can manage that hopefully by your appointment setting and letting your clients know, I will text you or call you when it's safe for you to come in. Just don't come in, or have a sign on the door that says, reminder, don't come in until I call you in, because I need to make sure the space is, properly sanitized and ready for you before you come in to the incoming client.
Is there a prescribed amount of time? This particular person said they already have 30 to 45 minutes between clients. Does that need to be further a larger amount, especially if it's a procedure where someone takes off a mask?
Yeah, no, I think that's up to each service provider to kind of figure out how much time they need to kind of go through the steps that they're comfortable with to prep and prepare in between clients. So there's no prescribed time.
And so I agree with that. The one thing I would add is, if you're using cleaning products, follow the directions on the label. If they say they need to be,
oh, good point,
on there for 30 minutes before you wipe them off, whatever it is, the directions, the cleaning products need to be used as labeled for them to be effective and for you to be protecting yourself and your clients.
Okay. So with the new rules allowing the additional treatment on areas that have masks, that you can remove the mask, the changes that were made in the last couple of weeks, does that include lip piercings and some of the tattoo functions that happen on the mouth?
Yeah, so for a lot of those services that weren't allowed before, they are now. That is now a doable service that is allowed.
And for a body artist to understand, what they may have to do in addition to what they've always done, you do have somebody at Boulder County Public Health that can work with, Melissa can work with body artists to figure out if there's any additional requirements necessary for them.
Yeah. Okay. Yeah. And we know that separate space is going to be, the recommended separate space might be hard because there just might not be a physical separate one. So it might be a matter of spacing a chair and leaving one unoccupied if at all possible, and then have the next person even further away, so you can still maintain that 6 feet distance, because that was the one change. There now needs to be, and we reviewed it, but just in case it wasn't widely heard or understood, there now needs to be 6 feet of distance between service providers. Before there wasn't, but now there is. So you have to make sure you're maintaining 6 feet of distance. Even if your stations aren't, you're going to have to then skip a station to ensure you have at least 6 feet distance between where the services are happening between clients, which would be the best way to handle some, especially if they're removing a mask, is be as far away from any other services and clients and staff as possible, skipping stations or, reutilizing rooms differently or whatever it might be, to ensure that the person who's taking off their mask is as far away from anybody else. It's just you and the service provider and the client, if at all possible.
I've heard of some local personal services companies extending their hours. So you'd have, shifts, or they do certain services only in certain hours that you're not you're not having too many
Great
individuals.
way to manage it. Yeah, great best practice kind of ideas. You know, certain things at certain times to better be able to physically take advantage of your space as much as possible instead of everything happening all at the same time.
And then we've heard of, personal services limiting the retail time so that those don't count against the people in the space. Also trying to filter the retail clients in a different way so that you don't have convening of individuals within.
We still highly recommend for both groups to do curbside pickup for any retail, if at all possible. Put your products online if at all possible. Let them shop online, pre-buy online, all of that. So you just reduce that contact point, and then you're not, like Corinne mentioned, messing with your limits or making it harder to stay within your limits as retail clients can come in sort of unexpectedly. So to kind of control that as much as possible is only going to help just the whole flow of the space work to everybody's advantage better.
Okay. I've also, just on the curbside piece, I know Amber, went over in detail the curbside, which has become in some cases, how retailers have continued to operate. Same thing with restaurants, instead of opening to full capacity. Just know that some of your municipalities do have the ability to apply to create curbside spaces in front of your building. So make sure you check with your municipality to see if that's available to you. That is something that not a lot of people have applied for, but there are still a lot of people doing curbside out there. So be aware that your municipalities control that area, what we call the right-of-way areas, and there may be some opportunities to extend into those areas for some of the services that you provide.
And Amber, is there still that great handout on curbside that's available on our website with a lot of suggestions and best practices? Is that still available?
I haven't checked lately, but yeah, if it's still available, do you want me to send you the link?
No, I send it out with this group, so if it's, I'll check to see if it's still available, and I'll send it out.
I know
that right now too, because that was really a helpful handout.
Yeah.
Just the reminder was about, your municipality controls that, the spaces in front and your alleyways and all of that. Do we have any other questions out there? If not, reminder, this is July 4th weekend. Let's stay safe. Let's stay healthy. Let's practice, social distancing, washing hands, wearing masks, communicate to your customers, communicate to your employees. We're already seeing the retraction of one industry backwards, and we don't want to see that in our communities. So let's practice and stay healthy this weekend. And please join us next week. We'll probably have more clarity on what Protect Our Neighbors might look like and where Boulder County stands as far as when it can apply. They may not know for a little while, but at least have more clarity on that phase. In this week's email, I am going to send out the state epidemiologist projections on statewide level on where we are, and the language for the updated mask order that Jesse mentioned for Boulder County. That's an indefinite order, as well as all the resources mentioned today. So stay updated, ask your questions, and continue coming to these calls. We'll see you next week.
Thanks,
Thank
everybody.
you.
Bye.